My name is Sophie Cahen. I'm an INSEAD 16D. And 2 years after graduating from INSEAD, I launched Ganymed Robotics, which is a surgical robotics company based in Paris with a subsidiary in the US. In close to 7 years, we've raised $50 million and filed over 50 patents internationally. The team now is comprised of 45 people, mostly engineers based in Paris, and it's been my pride to lead the team for the last 7 years. So there was a first revolution happened in medical technology and access to medical care, which was the invention of new therapies, new ways of doing surgery, new ways of curing people with diseases that previously had no solution. Typically the pacemaker or even joint replacement surgeries, which were developed in the 70s. But today, while a lot of therapies exist, there's a lack of accessibility because there are not enough trained practitioners, or because people don't have the means to access some of these important procedures. And therefore, there is a need to democratize access to care by providing better, safer, affordable solutions for people to get care. The early days of building a medical startup are basically looking for money and looking for people. So once you've got the money, you're looking for the people. And once you've got the people, you're looking for the money. And it's this endless circle, which means a lot of things, because it means you have to figure out exactly the problem you're trying to solve, the risks that you're facing, and learning to talk to investors in a way that is compelling, while doing exactly the same with candidates who have no reason to join your company because you're a small and unknown startup, and because by definition, they're very competent, they have a lot of options. And so it's basically selling your project constantly to basically two categories of people, and more, of course, if you add the suppliers, public authorities, etc., etc. INSEAD played a major role in my venture journey. I think on multiple aspects. The first one is that when I was at INSEAD myself as a student in 2016, I participated to the INSEAD Venture Competition. Now, I submitted a project that had nothing to do with the one I eventually founded, Ganymed Robotics, which was a project to start a boutique hotel chain in Iran. Back then in 2016, the world looked a bit different. Barack Obama was still president, the nuclear deal was in full effect, etc. So it made a little bit more sense then. I came second at the competition, so I was a runner-up. I got some prize money, and basically, interestingly, this gave me the confidence to actually move to Iran and work on the project, which is what I did after INSEAD. I'll fast forward to the end of the story. Eventually, the hotel chain did not get built, but I ended up being a CEO of a travel tech company based in Tehran. So I would say the first thing was giving me the confidence with the IVC, but also the classes. I realized I was on par with the world's, leading business people, or so it seems. And so I felt, okay, maybe I have my place here, and there's things I could do. That's the first thing. So the part is confidence. The second is, of course, the network. And so when I came back to Europe, and I was in the process of launching Ganymed Robotics, I started hosting dinners of INSEAD Medtech CEOs in Paris to benefit from their experience, to gain from their mentorship. And very interestingly, there were a lot of INSEAD Medtech CEOs in Paris that were willing to spend time with me, give me some tips, share some insights, open their address books, give me some contacts, etc. And so this was a huge help at the beginning. A third aspect in which INSEAD, and more importantly the INSEAD alumni network, perhaps helped my venture journey is that I hired an INSEADer to be my right arm at the beginning of the journey, and I ended up with INSEADers on my board as well. And so I've been basically surrounded by INSEAD alum all over the entrepreneurship journey.